So I'm wondering if you could actually very simply just explain to our viewers what you mean by Bridgital and how it addresses precisely the problem that you've just raised for us, so the challenge, the core of the challenge for India that you've just raised for us.
Sure. So, I think we came at it from, this idea, and I think that the popular sentiment that typically when you think about technology, the idea is that it's going to take away jobs and we're going to automate away all jobs. And I think what we wanted to think about is, in India, perhaps technology offers an opportunity to bridge these two challenges in a way that would never have been conceivable before. And so if we can think about designing digital interventions, specifically gearing them towards solving access challenges, do we see potential for jobs being created? And that's exactly what we did come to find. And a lot of this came from the ground up. So, I mean, Bridgital is a very, it sounds like a buzzy word, but I think the simple way to think about it is that when you think of digital interventions, it's that specific subset of really trying to understand, study the digital interventions that will lead to more jobs. And especially, I mean, I think it's true for both developed and developing worlds that there is this subset of sectors where you will see net jobs increase. But in the developing world, I think there's a huge scope for technology to open up markets that didn't exist before. So let me just take one digression, right? A lot of this idea that technology is going to take away jobs has come from the developed world. And you can see that for good reasons because of demographics, aging populations. The need is to be able to use technology to substitute for jobs. But in technology is making existing markets more efficient. In developing countries, or in India, let's say, let me just specifically talk about India, technology can lead to opening markets, like providing access to healthcare, right? Which didn't exist at all before. It's not like these markets existed. And when you're building the basic building blocks of these markets, and infrastructure develops where you need local jobs in particular to be developed. And we saw this, the Tata Group had done pilots, healthcare pilots across the country. And, the initial idea was, how do we use technology to provide health access? And typically what happens is that people design a stack, right? Design a tech stack, design a health stack, you design a ed stack, whatever it is. But what we tried to do is to say that a tech stack alone is not going to solve this problem. And we've seen that happen before in India, throwing technology at a problem, and it's just obsolete. But what you need to do is have the technology surrounded by two other big interventions. One is arming the ground workers or the field workers. So in healthcare, it would be ASHA. In India, we have ASHA workers, who are the ground level healthcare providers, or it would be teachers in the educational sector, example, truck drivers and so on. And on the other side, you use technology to connect the infrastructure that you already have. So like I said before, we have infrastructure, but it's not as efficiently used as it could be. We're not stretching those resources to the max. But when you can use technology to hook up hospitals, figure out, you send someone here rather than there, you can use the district hospital when is needed, but you can use a subcenter for other things if they're connected. So using technology to connect the existing infrastructure, get technology to like a tablet, as basic as a tablet, to augment the field worker. And then you have the tech stack, which is able to take all the structured and the unstructured data and be able to give you the insights that you need. Then all of a sudden magic starts to happen. And what we saw in the pilots were that you saw where people never used primary healthcare. They would never go to the most local facet. They would go to, everyone would crowd the tertiary care. But when you make this happen, all of a sudden you'll see that access to primary care goes up. You get better patient outcomes. And we had to hire people to be able to do this. You need all these intermediaries, whether they're digital intermediaries or health intermediaries. And so that's the idea for Bridgital, that if you can really think through designing it in that way, you can see net jobs increase and you do see that access gap closed.